Assalamu alaikum. Welcome to 10 Clinical Minutes. In the next few episodes, I will be presenting you with a brief introduction to cutaneous vasculitis. And we will start part 1 with the large and medium vessel vasculitis. Vasculitis means inflammatory damage to the blood vessels with consequent narrowing, ischemia, and damage to the surrounding tissue with site-dependent symptoms and signs. For example, if this damage affects the lung vessels, the patient will present with respiratory manifestations. If the cutaneous vessels are affected, we get lesions like purpura, ulcers, blisters, etc. Cutaneous vasculitis can be a component of a systemic vasculitis, where the skin lesions are only a part of the systemic vascular pathology. Or the systemic vasculitis may have a skin-limited or a skin-dominant variant. The third form is the single-organ cutaneous vasculitis, where only the skin is affected without other organs or any associated systemic vasculitis. According to the vessel size affected, we have large, medium, or small vessel vasculitis. The famous leukocytoclastic vasculitis is a term describing inflammation of the small vessels of the dermis and subcutaneous tissue associated with leukocytoclasia, and this is not specific for a certain type of small vessel vasculitis, but rather a descriptive term of the histopathology. The large vessel vasculitis, there is inflammation of the aorta or its main branches. And we have two diseases in this category, the Cutaneous Vasculitis or pulseless disease, and the temporal arteritis or giant cell arteritis. Because the affection is of the large arteries, which are absent in the skin, the cutaneous manifestations of both these disorders are quite uncommon. However, occasionally, ischemic manifestations may appear over the skin, like mucocutaneous necrosis of the head and neck, and this is mainly described with giant cell arteritis rather than Takayasu arteritis. In giant cell arteritis as well, we can find nodular lesions, erythema multiforme-like lesions, as well as rare occasions of reported granuloma annulare. For the medium vessel vasculitis, there is an inflammation in the medium-sized vessels. And we have two diseases in this category, the polyarteritis nodosa and the Kawasaki disease. Both conditions are systemic vasculitis with distinct cutaneous component. However, polyarteritis nodosa may present with a skin-limited type with minimal systemic affection. We call this cutaneous polyarteritis nodosa. The classic polyarteritis nodosa is diagnosed according to the American College of Rheumatology criteria. And please note that the cutaneous lesions here is livido racemosa rather than livido reticularis, with other skin lesions like infarctions, ulcers, and the famous nodules of the polyarteritis nodosa. 3 of the 10 criteria must be established for a diagnosis of polyarteritis nodosa, and the involvement of the medium vessels will result in the skin infarction, the livido, the intradermal nodules, and the deep ulcer. However, there is rare involvement of small cutaneous venules. And in this case, you may see purpuric lesions, hemorrhagic macules, erythema, and even superficial ulcers and blisters. The rare skin-limited type of polyarteritis nodosa is a chronic and relapsing vasculitis, but of the small arteries and arterioles in the dermal tissue and subcutaneous fat. It is mainly confined to the extremities, particularly the lower limbs and the foot, and it presents with livido, macules, subcutaneous nodules, and sometimes some ulceration in rare cases. However, also we can find very mild and rare systemic affection in the form of nerve affection as well as muscle affection. Kawasaki disease is the second medium vessel vasculitis that we are going to discuss, and it may show cutaneous manifestation of vasculitis. The vasculitis affects primarily muscular arteries, including the coronaries. And for the diagnosis of Kawasaki disease, the patient must present with a 5-day fever and 4 out of 5 diagnostic criteria, including the bilateral conjunctivitis, the strawberry tongue, the edema of the hand and feet, and the cervical lymphadenopathy, and the polymorphic rash, which may be maculopapular, erythematous target, or even sometimes bullous. Actually, the frank purpuric cutaneous lesions are very rare, and they usually denote that this is a severe form of Kawasaki disease. Thank you very much, and next time we'll start talking about small vessel vasculitis.